Cases are rising in a number of European nations, and they are reinstituting the draconian measures of early pandemic. We have a lockdown for the unvaccinated in Austria. We also have a partial lockdown in the Netherlands, and cases are climbing in Germany. What does this mean for the United States? Are we going to follow the path of Europe? I think this is a very difficult question to answer because currently available evidence makes it quite difficult to know precisely why the cases are rising in parts of Europe. Are they rising among vaccinated or unvaccinated people? Media headlines are quick to proclaim, in Germany at least, they claim it is an epidemic of the unvaccinated, that there is a population, a pocket that has remained unvaccinated, and they are particularly vulnerable. But there are also reports from a number of other nations that there are rising breakthrough cases. After vaccination, people have cases. That has been well documented for about 6 months now. What are we to make of all this? I think it's very difficult, especially in the United States, where we have a utter lack of data. I've seen many calls for the CDC to put up in fast and real time the number of hospitalizations among people who have not been vaccinated, among people who have not been vaccinated but previously had SARS-CoV-2 and they have antibody positivity, and among people who have been vaccinated. That information will be very useful, and we need to see that in real time and where it's happening, based on what age groups, what comorbidities. This will give us a better sense of what the policy response ought to be. We just don't have that information. Will the United States follow the footsteps of Europe? I think it depends. It depends on what natural immunity is in those European communities where the virus is spreading. At least in the United States, even though we have some big pockets where vaccination was not as good as many would have liked, those pockets do have often high rates of natural immunity because they have previously been hit in prior surges. So we will walk into the fall and the winter without an exact idea of what's to come. And in part, that could be ameliorated with better data. But I have a few other thoughts here. One thought: there are only a few things you can do to substantively change the risk of SARS-CoV-2. And those things are, for an unvaccinated person, particularly an older person, to get vaccinated. For a healthcare system to have abundant supply and do the things now to prepare for a surge in the future. To be honest, they've had many months, 18 months to do that. But beyond those two things, every other intervention is either delaying the time until you come into contact with SARS-CoV-2 or doesn't even delay the time until you come into contact with SARS-CoV-2 and costs you something else. So what's in that last bucket? That would be sort of prohibitions on meeting outside or masking rules outside. Those are not going to even delay the time until you encounter the virus. They're just not going to do anything of value. They're just going to have a human cost. Then there are things that might actually delay the time until you encounter the virus. Very likely, draconian lockdown under some circumstances does do that. But the challenge there is, I think, at least in this country, the appetite for those restrictions is nearly entirely gone. Certainly gone in many parts of this country where people have fatigued with that intervention. But even in the parts that love that intervention, I really wonder what the on-the-ground reality would be to try to re-implement such a thing. In fact, had we never done it in the first place, we might not have even considered it an option, as many pandemic guidances prior to the current era had argued. When it comes to those risk modification measures, the measure of vaccination, the measure of making sure your hospital is capable of handling a surge, I think that's something that can be worked on. However, brute force tactics are likely to be a double-edged sword. If you push very hard on the vaccine mandates, for instance, if you put great penalties on that, you may lose a lot of trust from the public. You may lose the faith you will need down the road if there is something to happen. So I don't know what the winter will bring in the United States. I hesitate to speculate. I think what we're seeing from Europe is concerning, and whether or not their response is appropriate, I also think requires further evidence. But I do think that there is a fundamental difference between the United States and Europe, which is that the appetite for those restrictions, again, in the United States, I think, is far lower than Europe. This has always been a very different nation, and I do not think you will be able to reinstitute politically, practically, with the consensus of the populace, what you are doing in Vienna, Austria. Those are my broad thoughts here. And the thing that we can actually do now, I think, would be to have real-time, accurate data and to be quite honest about rates of breakthrough infection among people who have had SARS-CoV-2 and cleared it, among people who have had SARS-CoV-2, cleared it, and got vaccinated, among people who have just gotten vaccinated, and among people who have done none of those things. I think, very likely, the group that you can best target to take the pressure off hospitals It's likely not going to be the very young people because their rates of hospitalization, even if they're infected, are quite low. It's very likely to be the oldest people who remain unvaccinated. Their rates of hospitalization, were they to get infected, are quite high. That's the group you need to focus your energies on if you want to take the pressure off hospital systems. So, looking to Europe, I think there are lots of things uncertain in the fall. I'm not the sort of person who makes proclamations without evidence. I think we're better off thinking about what might happen and what systems in place we need to stay abreast of minute to minute what's going on in the United States and what ought to be done in response. And ultimately, we cannot forget there are scientific choices with varying degrees of evidence, but there are policy choices. And policy is always science plus values. And for values, you must include, I think, the will, the desires of the American people. And so those must be queried. So that's what you get on this channel. If you like this video, you know what to do. Like, subscribe, comment, leave a message below. Hit that little bell so you get notifications. Until next time.